Well, good morning. I'm early, I'm late, I'm here. That's at least where I'm at. You never know for sure. But today, ta-da, I want to talk about what are we talking about when we talk about let's get organized, let's have a message, let's send the message, and let's do what we can do to change what is into what we want it to look like. Now, first thing, we are not saying everybody is going to be comfortable or want to do what we're doing. I get that. What I will say to you is you should do what feels and seems right for you, for the individual for whom you have the responsibility for being their healthcare power of attorney or their advocate or their partner. So I am not asking people who are like, I want them to be absolutely isolated except for the care they receive by people who are following all the absolute guidelines, and all those people need to follow that guideline, and that's what I want for my person. And if I do that, and if they do that, then that's what will make me feel comfortable. If that's what you and your person have worked out and that works for you, then we certainly at Positive Approach say, that sounds like that's working for you. Your anxiety is less. Their anxiety is fine. They are not depressed. They are not saddened by what is happening. It feels right to everyone involved. Then that's great. Before COVID, we had people who had already isolated in many ways. And so COVID actually didn't change their life that much because they'd already done a variety of things that made their world very, very small. What we're talking about is enforced world shifts, enforced changes in care that aren't really working for a lot of people. And when I say not working, I mean causing harm. This is the idea that those of us in healthcare, one of the mandates we all follow is do good. Cause no harm. Do nothing that when you figure out that it causes harm, you keep doing it. And you have to equally distribute. You're not allowed to do things for one that you would not do for another in the same situation with the same resources. So now we get down to the meat of the matter, which is from the very beginning of COVID, people were lumped or dumped into categories, assuming they were equal. But the reality is that's not exactly true. Those of us who live independently, quote unquote, and freely in the world and have resources were given options on how we isolated, how we made things work for us. And people who were in families were certainly given the autonomy in some ways to manage family in a setting. So families were told the institutional resources of schooling would be provided in a different way. And they had to figure out how also they were going to do their work and their family care and the education in a home setting. And if they were not considered essential workers, they were to stay in that kind of setting, limit outside activities, and care for their children and work with the folks on internet to allow that. And we knew from the outset that many of those children and families were already starting to struggle. Some of that was working, some of it wasn't. Now, the people who were essential, which interestingly enough, when I keep reading whatever I read about essential workers, even when people thank essential workers, they tend to forget people who are living in giving care in residential care. They're just still skipping those people. They are not lifted up and they are not celebrated as the heroes they are, as are the people at the post office and the people at UPS and the people who are in the hospitals and the people who are, people in nursing homes are more often vindicated and vilified. And it's like, whoa, 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 whoa. There are a lot of amazing people who are going in there every single day. And in some locations, they actually put themselves in isolation from their own families to reduce risks. But in other cases, that's simply not possible because those essential workers were asked to continue to put themselves out there at risk and then come home and deal with whatever they had to deal with at home without a lot of additional, what resources? What essential workers were given additional resources of childcare, of family care, of support for their families while they went and did these other things? They were just supposed to figure it out, much as in dementia, we're asked to just figure it out without the kind of support that we need. So I keep talking about families because I think what we're talking about is the other end of this family spectrum, from child to parent, parent to parent, parent to spouse, spouse to spouse. We're talking about people who have made choices, active choices, to be involved in someone's life through their lifespan. And that means as my physical health, as my cognitive health, as my social abilities change, you still want to be bonded and part of my life. Now, how much of what you do? Well, that's where this team has had to often expand, because we were never, as humans, meant to carry another human 24/7 and do well with that. As the human's abilities changed and changed, this wasn't a small child who is going to gradually become more and more competent and capable with our guidance and our support and our help and their experience in their brain and their body. They are designed to become more of a independent person. And yet people who are living to the end of life, part of living through that increasing age or increasing cognitive change means that independence isn't really on the table. And so accepting that independence is not on the table, we need a game plan during COVID, much as people are developing game plans for education for children and socialization for children, except they're not doing a great job in all cases there either. So here's our game plan. We need to look at what is. We need to look out and about at what is. All the players who want to come together to say, whoa, time out. This was never done well for people who are in residential settings, who are living with various types, forms, and amounts or degrees of dementia. It is also not working for people who are in nursing homes who have various and sundry degrees of physical illnesses or disabilities, possibly with also the need for social engagement for well-being, and possibly for people who are in mental health situations or mental illness situations where they too are being placed in these settings of isolation. The guidelines that were developed were not ever developed for people who, as part of their daily existence, need, and I use the word quite deliberately, need assistance in interaction with other humans up close and personal in order to survive and hopefully thrive through the end of their life. And when their life is ending, one of the guidelines of life is to be present until life is no more in that shell. And that human has felt part and supported to the very end. So we need a game plan that acknowledges and recognizes we are not actually, I'll be honest, I am not talking about family visitations. I am talking about care plans that actually care the part that was already broken in the system, that are designed as living care plans that cause us as a team to work together, that staff within the community, families within the world, and the people that we're supporting come together and figure out what will we do for whom and how. And there are ways to do this that will, in fact, support guidelines that are reasonable, rational, and scientifically supported. Having people do patio visits when they keep reaching out and trying to touch, because touch is their way of connecting, and say no touching, when in fact we could quite easily allow touch as long as the person being touched has no open wounds and has the wisdom to know, once you touch, do not touch your own face around breath. And when you go to touch, make sure you have sanitized or washed your hands and not touched anything else before you touch that human being. That's how people do not get it here and put it there. That is how people who might have put it here and reach out are safe to touch, because I have the right PPE. And the first level of PPE from the very beginning, this, and these. So we need to get honest about what protection looks like and what care needs to be. And we need to start recognizing and just get it out there. People who have cognitive impairment need different kinds of support. They need physical support, they need emotional support, they need cognitive support, they need spiritual support, they need community support. So we are building a team of people, and one of the things we have got to do as we're coming together is work on this thing called compromise. And we also have to recognize there is expertise among us. And in this compromise, we are going to be working with expertise, because we need, and I do mean need, finger up, to get the attention of people in power to say, pause. I'm asking for a big favor here. I want us to acknowledge that we did not stop the spread of COVID in residential settings just because we stopped families from being present. We did not stop deaths of people living in residential settings just because we separated families out. We did not get all care staff on the same page as far as looking hard at who needs what and delivering what is needed to whom. And the idea that individuals who moved into residential settings in order to be a community are not a family in assisted living isn't really recognizing how this was meant to be. So we're trying to make them mini hospitals. That's not what they're for. If we need hospitals, we need to talk about hospitals. But if we need care for people who don't have COVID, we need to talk about care for people who don't have COVID but do have dementia, do have problems with mobility, do have problems being able to help themselves eat, to help themselves toilet, to help themselves bathe, to help themselves communicate. If they need support, what are we doing not supporting them? That's not care. That's neglect. And it's nobody's desire, but it's happening. And we've got to acknowledge it's not right, and let's come up with a plan to fix. I've got some expertise on the hows, but I'm going to need help on the who's and the how we move this forward at a national recognition level. So we're bringing people together. Corey, you want to give us the details on when we're doing a roundtable next week? This week we have more people. We have a physician on Friday coming on, working in the community that Mary Daniels was in, and that community is really recognizing this is not enough. Whoa. And we're going to talk about awareness, knowledge, and skill so that we can build competence at getting through COVID. That's what Positive Approach has to contribute. We're willing to do the training if need be. Go for it, Corey.
All right, so we are looking to host a roundtable next Tuesday. It'll be during this time at 8 a.m., but it'll run from an hour to an hour and a half. And we're going to be bringing in some staff from facilities where they're trying some of this stuff and it's working. We've got some family members who are going to be present, and I believe a medical director. We're still confirming all of those because this was an idea that we had, and we want to make sure it's going to work for everybody. So as soon as we have those details ironed out, we will post them here so that you can come and join us.
If you have anybody you think we should include because of their position or their view of the world, we're into connecting and communicating. This is not an arguing session. This is a brainstorming for change. I will share out some of the things that we are doing and have done and some of the awareness and knowledge and skill that I have, but we're looking for that same thing for others. Oh, so I wanted to show you just before we finish, because I know we've got to go. You guys have all got to go. I want to show you a map because this is a really scary map. And this comes from Kaiser's Health information. Take a look at this map. Those orange states, that's where people can actually do quote unquote patio supervised visits kind of thing in nursing homes and assisted livings. And then we have the yellow, which is nursing homes only. And then we have a lot of gray, which means no visitation. So if you're interested in more about that, now those will change basically every single day. But what I want you to recognize is these oranges aren't necessarily good news because we still haven't got the specifics in place that can optimize people staying safe and the need that they have to connect. I would also say the number of times that people who are living with dementia, because they like to touch or won't wear masks, are not included in this. They are being basically subcategorized as not visitable because of their behavior. And yet, those are the people who need touch the most. Anyway, all right, enough of being ugly. I'm not really, I'm being honest. Because if you don't understand dementia and the needs of people living with dementia and the abilities of people living with dementia and the joys of people living with dementia and the potential of people living with dementia and their families and their staff providers, then we need to build your awareness. And then we need to work on knowledge and skill because dementia is everywhere and brain change is everywhere. Which is our biggest challenge. All right, till tomorrow. We'll be back tomorrow. We have a plan. We're starting to work on it. We've got some specifics, but we need some help. I'm calling for help because I can't do it all alone, but I do have some skill to bring to the table. If you want to be part of what we're doing, join us. If you want to talk about what we're doing, join us. Oh, by the way, tonight, 7 to 8:30, Ask Teepa Anything. Oh, I'm sure this will come up, but we have lots of other topics to discuss as well. We've had all kinds of questions on Facebook, and we will be answering some of those. If you want to come and be part, there's a way to do that. Take a look on the Facebook page. It'll tell you how. All right, till later. Thanks, everybody. Be well, care with care, and we'll talk more soon.
Hey folks, thanks for watching. Please like and subscribe to help us spread Teepa's positive approach message around the world. And don't forget to click the bell to get notified when new videos are posted.